Type 2 diabetes overview. The type 2 diabetes is a condition that happens because of a problem in the way the body regulates and uses sugar as a fuel. That sugar is also called glucose. This long-term condition results in too much sugar circulating in the blood. Eventually, the high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. In type 2 diabetes, there are primarily two problems. Pancreas does not produce enough insulin, a hormone that regulates the movement of sugar into the cells, and cells respond poorly to insulin and take in less sugar. This is kind of misleading because it's saying pancreas does not produce enough insulin, but type 2 diabetes is a condition of too much insulin. So even though your pancreas is not able to keep up with enough insulin to keep your blood sugars down, the actual cause of the type 2 diabetes is too much carbs, too much glucose. So this is true, but it's kind of worded in a way that's kind of sneaky because, yes, your pancreas cannot keep up with the amount of sugar that's in your blood. And so there becomes like a dip where it just can't produce enough to keep up with it. So they recommend usually treatment or giving you insulin therapy, which gives you more insulin to try to keep your blood sugar down, but you're not addressing the actual issue, which is your cells are ignoring insulin, as it says here, and cells respond poorly to insulin. But it's just because there's just too much insulin. So, yeah, again, it's true, but not really true. You have to kind of be aware of this because they're giving you insulin with the idea that your pancreas doesn't create enough, but that's not the actual cause. That's kind of an end result, a consequence of having your insulin elevated chronically, constantly, every day. Type 2 diabetes used to be known as adult onset diabetes, but both type 1 and 2 diabetes can begin during childhood and adulthood. Type 2 is more common in older adults, but the increase in number of children with obesity has led to more cases of type 2 diabetes in younger people. Yeah, there are people who are obese that have type 2 diabetes, but there's a lot of people, millions of people who are not obese and have type 2 diabetes because they're overweight on the inside. They have visceral fat. Certain people from certain countries, certain regions, certain parts of Asia, parts, in Singapore, these places, there are other countries, don't know them off the top of my head, but they're more prone to having visceral fat. So they look thin, but they're diabetic. So we don't want to get too hung up on this obesity because, again, having this in our head, it kind of makes us feel like, well, I'm not obese, so I must be healthy. This doesn't apply to me, but that's not the case. There's no cure for type 2 diabetes. This is false. It's absolutely false. Millions of people have reversed their type 2 diabetes by just cutting out sugar. Because again, it's an issue of too much insulin. So you can see why treatment with insulin therapy is problematic because it's just compounding the problem. Losing weight, eating well, and exercising can help manage the disease. We don't want to manage it. We want to cure it. If diet and exercise aren't enough to control blood sugar, diabetes medication or insulin therapy may be recommended. And this is because there's just this vague eating well and exercising, proper diet and exercise, this generic prescription, because the vast majority of doctors don't know anything about nutrition. They don't know what you should eat or not eat or what type of exercise to do. They usually refer you to a dietitian or some other person who doesn't know what they're talking about. And so this vague diet and exercise aren't enough because people just don't know what kind of diet. And exercise is great for mood. It's great for getting the blood going, getting your heart pumping, but it's not used as a sole means of losing weight. For that, you need to change your diet. And so I recommend, and many people recommend, that if you are type 2 diabetic, work with your doctor if you're on insulin therapy to get on a carnivore diet. This will absolutely reverse your type 2 diabetes, or at the very least require minimum insulin, which is good because insulin in high amounts and sugar in high amounts is toxic to the body. Symptoms of type 2 diabetes often develop slowly. Yes, it starts as insulin resistance, which I know is a concept of how the body naturally responds to too much sugar in the blood. And this could take decades. So you could be on your way to diabetes and not realize it. In fact, you can be living with type 2 diabetes for years and not know it. When symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss. Well, I thought they wanted to lose weight to help with type 2 diabetes. So, yeah. Fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin, usually in the armpits or neck. Yes, and also skin tags. These are also, these are the extreme because we're just talking about type 2 diabetes. But if you want to catch type 2 diabetes early, meaning fix your health before it becomes type 2 diabetes, you need to get a fasting insulin test. This will show your level of insulin. And if it's high, so therefore if it's high, it means it's chronically high, because if it's very high, even when you're fasting, you know you have insulin resistance and that you need to cut out the sugar ASAP. When to see a doctor. See your healthcare provider if you notice any symptoms of type 2 diabetes. So if you're blacking out, if your vision is blurred or blacking out, or if you see that it's very serious, I recommend you first cut out all sugar, do carnivore. If you're not on any kind of medication, and then you'll see things drastically improve. From the Mayo Clinic to your inbox, sign up for free, blah, blah, blah. Causes type 2 diabetes mainly the result of two problems. Cells in muscle, fat, and the liver become resistant to insulin. As a result, the cells don't take in enough sugar. The pancreas can't make enough insulin to keep the blood sugar levels within a healthy range. So even logically, if you read this, the cells in the muscle, fat, and liver become resistant to insulin. Why do they become insulin resistant? Well, it's because of too much insulin. And what raises insulin? Carbohydrates. Not meat, not fat, carbohydrates. So the answer to the problem, the cure to the problem, is to cut out sugar. And you don't need dietary sugar. The body makes all that it needs. The liver converts protein to glucose to feed the brain, to feed parts of the body. There's certain cells in the body that need glucose. But excess, eating it in our diet is too much sugar. And because processed food is so addictive, we end up eating so much sugar that it leads to insulin resistance, which then leads to type 2 diabetes. How insulin works. Insulin is a hormone that comes from the pancreas. Called beta cells from the pancreas, a gland located behind and below the stomach. Insulin controls how the body uses sugar in the following ways. Sugar in the bloodstream triggers the pancreas to release insulin. Again, another clue. What triggers the insulin? Sugar. Insulin circulates in the blood, enabling sugar to enter the cells. And the reason it goes in the cells is because the sugar is toxic. And it's trying to protect itself by getting it out of the bloodstream and putting it into cells. The body's basically saying, hey, we have excess glucose here. This is toxic. How can we get rid of it? And so it'll either put it in the cells to be burned as fuel right away. And if there's even excess, it'll store it into fat cells. The amount of sugar in the bloodstream drops. In response to this drop, the pancreas releases less insulin. So again, another clue. As a response to the drop in sugar, the pancreas releases less insulin. And so yes, if you don't eat sugar, your insulin won't go up at all. You'll have little ebbs and flows, little hills and valleys, from protein. If you're getting enough protein, which is good because insulin is a good thing. It's not an evil thing. We need insulin or we die. But when insulin is elevated, it's a problem. Too much of a good thing, so to speak. The role of glucose. Glucose, a sugar, is a main source of energy for the cells that make up muscles and other tissues. The use and regulation of glucose includes the following. It's a main source of energy because we're traditionally taught and told to eat a lot of carbohydrates. And it's using this as energy. And again, it's using this for energy because it doesn't want it in your bloodstream. It's trying to get rid of it. Glucose comes from the use and regulation of glucose includes the following. Glucose comes from two major sources, food and the liver. Glucose is absorbed in the bloodstream where it enters the cell with the help of insulin. Food and the liver. So like I said, the liver converts protein by a process called gluconeogenesis, and it produces the glucose that we need. No more, no less. The liver stores and makes glucose. When glucose levels are low, the liver breaks down stored glycogen into glucose to help keep the body's glucose level within a healthy range. Yeah, so this is the natural way in which our bodies regulate glucose. Again, we do not need dietary glucose. We eat it because it's so palatable. It tastes so amazing, especially processed food. I get it, but it's not real food, and it's very detrimental to our health in the long term. A lot of young people get away with this. They think, oh, I'm fine. This guy is a Debbie Downer. But when you get to my age, when you hit your 50s, if you're not doing things right, this is going to catch up to you, or maybe even sooner, maybe even in your 30s or 40s. If you're on medication in your 30s or 40s, that should be a wake-up call. In type 2 diabetes, this process doesn't work well. Instead of moving into the cells, sugar builds up in the blood because of too much insulin. The cells are saying, oh, let's ignore insulin because we don't want any more sugar in us, because if it didn't do this and it allowed and continued to allow glucose into the cell will die. So to protect itself, Allah has built us perfectly. Everything can repair itself if we take care of it. The body can absolutely take care of itself. Very intelligent. As blood sugar levels rise, the pancreas releases more insulin. Eventually, the cells in the pancreas that make insulin become damaged and can't make enough insulin to meet the body's needs. That's where they usually end the story, because they want to give you treatment. They want to give you insulin, which over time has to just constantly be increased. And it's damaging, causing more and more problems, usually leading to cardiovascular disease. You'll have all kinds of issues because the root cause is too much sugar in the blood. Factors that may increase the risk of type 2 diabetes include weight. Being overweight or obese is a main risk, although there are metabolically healthy obese people. That's an actual medical term. People who are overweight, who look obese, but by all accounts and purposes, they're healthy. They don't have diabetes. They don't have any kind of high blood pressure. They don't have any issues. Because for the most part, subcutaneous fat, this fat on the outside, is not an issue. It's the visceral fat under the stomach lining that causes major problems. Fat distribution. Storing fat mainly in the abdomen rather than the hips and thighs indicates a greater risk. Yeah, belly fat is a big sign of insulin resistance. The risk of type 2 diabetes is higher in men with a waist circumference above 40 inches and in women with a waist measurement above 35 inches. Inactivity. Less active a person is, the greater the risk. Physical activity helps control weight. No, it doesn't. Uses up glucose as energy. That's just true. That's one of the main benefits of exercise. It makes cells more sensitive to insulin. Yeah, exercise is good for this. So if you have a meal, if you're on carnivore, you don't need to worry about it. But if you're still on a SAD diet, standard American diet, it's good to do maybe a 10, 15-minute walk after a meal. This helps minimize insulin production because you're using up that sugar in the blood and putting it into your muscles to fuel the walk or workout, whatever it is you're doing. Family history. Individuals' risk of type 2 diabetes increases if a parent or sibling has type 2 diabetes. This is more a thing if you're following the same lifestyle and diet and everything that your parent has been following, which is more likely because your parents are feeding you, so they're going to feed you the same things that they're eating. But it doesn't mean that just because one of your parents has type 2 diabetes that you're going to get it, but you are at a higher risk if you're eating a high-carb diet. Race and ethnicity. Although it's unclear why, people of certain races and ethnicities, including Black, Hispanic, Native American, and Asian people and Pacific Islanders, are more likely to develop type 2 diabetes than white people. It's a lot of this has to do with certain people in these countries, like I mentioned earlier, are more likely to get visceral fat. So they get fat under the stomach muscles. And so there's really no sense of urgency to change the diet. You know, we see people say, oh, he can eat whatever he wants and he doesn't gain weight. Well, he's gaining weight, but it's gaining on the inside. And of course, you can only gain so much weight on the inside. Allah is merciful. He's not going to allow us to gain as much weight on the inside as the outside because we would explode. So if your background is one of these ethnicities, just be mindful that don't just go by your appearance. Get blood work done, see where you are, get a fasting insulin test, and cut down the carbs as much as possible. Blood lipid blood lipid levels. An increased risk is associated with low levels of high-density lipoprotein, HDL, cholesterol, the good cholesterol. There's no such thing as good cholesterol and bad cholesterol. And high levels of triglycerides. This is not true. I'll do a video on this. There's a lot that goes into this, but I'll just tell you there's no such thing as good or bad cholesterol, because these are like high density lipoprotein. This is a carrier of cholesterol. It's not cholesterol. All cholesterol is the same, whether it's an HDL, LDL, they're all the same on the inside. These are just different types of vehicles, so to speak. So this whole good cholesterol, bad cholesterol is totally wrong. Age. The risk of type 2 diabetes increases with age, especially after 35. This is because it does take years to damage your body. When you become insulin resistant, and then you're insulin resistant, your cells are resisting the insulin from years, even decades, until it finally your pancreas just can't keep up, and then you get type 2 diabetes. Prediabetes. Prediabetes is a condition in which the blood sugar level is higher than normal, but not high enough to be classified as diabetes. Left untreated, prediabetes often progresses to type 2 diabetes. There is no difference between prediabetes and type 2 diabetes. I mean, who's to say 100 is normal, 101 isn't? I mean, these are just numbers. There's no, we don't want to look at these as you have some number in your body, and as long as it's 100, you're good. If it's 101, it's not good, or 106. I think 106 or 107 is considered prediabetes. These are just arbitrary numbers made up. It's all bad. So you want your blood sugar to be in a fasting state in the 80s, or even maybe the 70s, but 80s is good, maybe 90. But if it's around 100, then you need to get a fasting insulin test. Pregnancy-related risks. The risk of developing type 2 diabetes is higher in people who have had gestational diabetes when they were pregnant, and those who gave birth to a baby weighing more than 9 pounds. Yeah, and again, this has more to do with what the person's eating. If you eat a lot of carbohydrates, then yeah, it can get out of hand. But do not diet when you're pregnant. Make sure you're eating properly. It's very important that the baby is a good weight. Like, the more fat, the better in terms of brain health, because the brain needs a lot of fat. So do not go on a diet when you're pregnant, and make sure you eat a lot of saturated fat. And I won't give too much details into pregnancy diet because I don't know really a whole lot about that, but I just do know if the carbs get out of hand, then you can develop type 2 diabetes. Polycystic ovary syndrome. Having polycystic ovary syndrome, a condition characterized by irregular menstrual periods, excess hair growth, and obesity, increasing the risk of diabetes. Yeah, this is an outcome of insulin resistance. Again, you could have this even before diabetes kicks in. Complications. Type 2 diabetes affects many major organs, including the heart, blood vessels, nerves, eyes, and kidneys. Also, factors that increase the risk of diabetes are risk factors for other serious diseases. Managing diabetes and controlling blood sugar can lower the risk for these complications and other medical conditions, including heart and blood vessel disease. Diabetes is associated with an increased risk of heart disease, stroke, high blood pressure, and narrowing of blood vessels, a condition called atherosclerosis. Nerve damage in limbs. This condition is called neuropathy. High blood sugar over time can damage or destroy nerves that may result in tingling, numbness, burning, pain, or eventually loss of feeling that usually begins at the tips of the toes and fingers, gradually spreads upward. Other nerve damage. Damage to nerves to the heart can contribute to irregular heart rhythms. Nerve damage in the digestive system can cause problems with nausea, vomiting, diarrhea, or constipation. Nerve damage also may cause dysfunction. Yeah, all this can also happen with insulin resistance. You can have this even before you're diagnosed with type 2 diabetes. Kidney disease. Diabetes may lead to chronic kidney disease and end-stage kidney disease that can't be reversed. That may require dialysis or a kidney transplant. Yeah, and this can even happen with normal blood sugar levels because your insulin is so chronically high, even though it's keeping the blood sugar, trying to keep the blood sugar normal, it's still doing that damage for years and years and years of having chronically high insulin. Eye damage. Diabetes increases the risk of serious eye diseases such as cataracts and glaucoma and may damage the blood vessels of the retina, potentially leading to blindness. Skin conditions. Diabetes may raise the risk of some skin problems, including bacterial and fungal infections. So if you have a really sharp odor coming from your armpits, for example, this could be a sign of too much bacterial accumulation, which can be caused by having high blood sugar. Slow healing. Left untreated, cuts and blisters can become serious infections, which may heal poorly. Severe damage might require toe, foot, or leg amputation. Hearing impairment. Hearing problems are more common in people with diabetes. Sleep apnea. Obstructive sleep apnea is common in people living with type 2 diabetes. Obesity may be the main contributing factor to both conditions. Also inflammation. A lot of people report after doing carnivore that they stop snoring after a week or two. Dementia. Type 2 diabetes seems to increase the risk of Alzheimer's disease and other disorders that cause dementia. Poor control of blood sugar is linked to a more rapid decline in memory and other things, and other thinking skills. Yeah, even now they're referring to Alzheimer's as type 3 diabetes. What it is insulin resistance. So because the brain does need some glucose, if those cells are resisting insulin and not letting the glucose in, you can end up with Alzheimer's or dementia. Prevention. Healthy lifestyle choices can help prevent type 2 diabetes. If you've received a diagnosis of prediabetes, lifestyle changes may slow or stop the progression to diabetes. And they kind of give themselves away here a little bit. They say if you have a diagnosis of prediabetes, lifestyle changes may slow or stop the progression. Well, because there's no difference between prediabetes and diabetes, shouldn't you be able to slow or stop the progression of type 2 diabetes? I mean, it's all the same, just on various levels. A healthy lifestyle includes eating healthy foods, choose foods lower in fat and calories and higher in fiber, focus on fruits, vegetables, and whole grains. Do not do this. This is kind of criminal in my opinion. You're going to tell somebody who's eating too much sugar and whose cells are resisting insulin because of too much sugar in the blood. And you're going to tell them to choose foods lower in fat, which almost always means it's replaced with sugar. If you buy any processed food that says low fat, it's always replaced with sugar. Because food tastes good, we enjoy foods that are either sweet or have fat. And so if you take out the fat and it doesn't have sugar, it's going to taste terrible. So what they do is you eat low-fat yogurt, low-fat cottage cheese, all this low-fat stuff is just substituted with sugar. So that's not good if you're type 2 diabetic. And higher in fiber, fiber is terrible. Focus on fruits, high in sugar. A lot of vegetables have sugar. Whole grains is just not real food. This is just terrible advice. Getting active. Aim for 150 or more minutes a week, moderate to vigorous aerobic activity, such as a brisk walk, bicycling, running, or swimming. Yeah, I don't see how they think a lot of people are going to have the energy to do all of this if they're diabetic. If, they're going to have a roller coaster of blood sugar. So I had anxiety and panic attacks just from having these blood sugar swings. And so, I don't see how they expect someone to have the energy to do all of this. And if they do, maybe for a few weeks, it's not going to be sustainable. Losing weight. If you're overweight, losing a modest amount of weight and keeping it off may delay the progression from diabetes to type 2 diabetes. If you have prediabetes, losing 7 to 10% of your body weight may reduce the risk of diabetes. That's not true. It's not a weight issue. It's a blood sugar issue. And having this vague lose weight, usually when they say that, they put you on a plant-based diet and you end up losing muscle. So you look on the scale and you think, oh, this is working. I'm losing weight. But you're actually losing muscle and you're still eating the carbs. And they just end up putting you on medication. This is all of this advice is to they know you're going to fail. They know it's not going to help. So they maybe say this so that you end up on medication. Avoiding long stretches of inactivity. Sitting still for long periods of time can increase the risk. Try to get up every 30 minutes and move around for at least a few minutes. Now it's all carbs. A lot of carbs causes type 2 diabetes. Eating carbs causes insulin resistance. This is it's so simple. They even said it in here. Not directly, but you can see in here where they tell us that the cause of insulin resistance is too much sugar. They tell you the cells ignore the insulin because they're getting too much sugar. Then don't eat so much sugar. It's just so simple. But, we, unfortunately, especially us as Ummah, as Muslims, we're raised to look up to doctors. We see them as these, almost like these oracles that you just don't question if they, we even hear in our lectures, a lot of times people give a lecture and they give the analogy of obeying Allah, like obey your doctor, like subhanAllah. They, brothers will say, if your doctor tells you to take this medicine, you don't ask them why, you just do it. Well, that's the problem. Doctors are not trained in nutrition. They're not trained to do any critical thinking. They're just trained to prescribe medication, to see patients. And even if they wanted to, they don't have time. A doctor can't sit in his office, research your symptoms to try to find the best course of action. They need to see you, prescribe, get you out, see the next patient. This is just the way it is. And this is what doctors tell me. This is what doctors tell people. They have videos, they have lectures where they tell people this. So we really need to question doctors the way we question scholars. We take our deen serious. We want to find out if someone's saying the Prophet, peace be upon him, says something. We want to get the dalil. Get the dalil from your doctor. If your doctor says, oh, you're pre-diabetic, ask him why. See if he knows. See if she knows. If she says, oh, it's your pancreas isn't making enough insulin, then ask, oh, then should I just stop eating sugar? See what they say. And for whatever answer they give you, say, oh, how does that work? Or, oh, why is that? Just keep saying how and why, and you'll see just how limited their knowledge is. So now don't get me wrong. Before I end this, I don't want you to get me wrong. Doctors are amazing when it comes to trauma, when it comes to surgery, when it comes to, the emergency rooms and these things and narcotics and things, painkillers, things for, anesthesia and all that. Unbelievable, amazing. Medical devices, technology is incredible. I'm not talking about trauma. I'm talking about healthcare. We're now in an age of sick care. Family doctors, general practitioners, these physicians, they have no idea how to get you to be healthy or how to prevent these non-communicable diseases or how to reverse diabetes. They have to prescribe medication. So anyway, I know I'd come off probably as a Debbie Downer in a lot of these videos, but I just get frustrated seeing how sick most of us are in the Ummah, how we just do whatever the doctors say, and then we suffer the consequences. So, inshallah, hopefully this has been beneficial. I highly encourage you to do your own research as well. I'll try to start putting the sources to what I'm saying in the description. Limited on time. I'm trying to really kick out more videos to try to get out there, inshallah. So, in case the algorithm doesn't like these videos because I'm talking against healthcare, modern medicine for the most part, inshallah, please share. Please try the carnivore diet if you have any kind of health issues. I promise you won't regret it. And again, another disclaimer, if you're on some type of medication, be sure to work with your doctor because you don't want any complications. And it's not going to be a complication of the food, of just eating meat and saturated fat. It's going to be a complication because your medication is predicated on you eating a lot of carbs and sugar. So inshallah, be sure to subscribe, share, like, help spread this truth, inshallah. And until next time, may Allah reward you for being curious and keep tying your camel. Assalamu alaikum.